Hi, everyone. It's Anita Lambert, your holistic health physio, and Hannah Ross from Vital Physiotherapy and Wellness. And we're really glad you've joined us. So today we're going to be answering your pelvic floor questions. And these are common questions that Hannah and I hear all the time as pelvic health physios. And so many of you out there are likely wondering the same thing. So everything from do Kegels really work? And in terms of what would be a sign that my pelvic floor is weak or not working as well as it could, as well as when you have that 6-week postpartum follow-up with your doctor, your midwife, and they give you the green light to exercise, what does that actually mean? And we're going to talk about a lot more. So for those of you who don't know us, we're pelvic health physiotherapists, and we love helping women like yourself. So whether prior to pregnancy, during pregnancy, or postpartum, resolve or prevent common pelvic floor and core issues, as well as help women have a positive birth experience and an awesome and efficient postpartum recovery. And so Hannah is the owner of Vital Physiotherapy and Wellness in Toronto, Canada, and I'm the owner of Holistic Health Physiotherapy in Peterborough, Canada.
And we're really using this as an excuse to hang out, but also we get, I think, like the most common question that I get asked, and I'm sure you do as well, is as soon as we sort of started with our clients and we start to educate them, the first question that we get is why? Like, why is this the first time I'm hearing this? Why hasn't anybody talked about this? What, every time they've encountered a healthcare practitioner or they've been chatting with a relative or their sister or their mom, their aunt, like, why hasn't anybody told me that these problems exist and that they're fixable? And so I think that's the goal here tonight.
Yeah, definitely. So if you're here, tell us, say hi, let us know where you're from, and any questions you have, make sure that you post below as well. And stay tuned because we'll be talking about, Hannah and I are going to be meeting here every other Monday with topics that you told us you want to hear more about. So we'll be talking more about our next topic later on after our questions. So let's jump in. Awesome. So Hannah, the first question, which was asked by more than a few women, is where is my pelvic floor and what does it actually do?
Okay, so this is pelvic physio 101 here. So I brought my handy dandy pelvis here with me today. I think, Anita, did you bring my pelvis as friend?
Yes, we've got 2 pelvises here. Yeah.
So let's actually talk about where your pelvic floor muscles are, because I think that people just think of they stop your pee and that's all that they do, right? They have a whole slew of roles, but the reality is this is a pelvis. This is your pelvic bones. Your pelvic floor muscles sit underneath your pelvis. So if you can use your imagination and think about your entire body, essentially your whole trunk sits right over here, and the pelvic floor muscles are at the base of that trunk. So it's a pretty important job that they're about to do, right? It's a pretty important place that they are. So your pelvic floor muscles attach at the front of your pelvis, from where your 2 pelvic bones come together, your pubic symphysis. They come all the way at the back to your coccyx, to your tailbone. You can see that in there. And they reach side to side from one sits bone to another. So if you sit underneath your bum cheek and you feel that little bone underneath there, that's your sits bone. And when we're talking about the pelvic floor, we're going to be talking about the muscles generally, but I just want to be clear that there's a whole bunch of other stuff that goes in underneath there. There are blood vessels and ligaments and tendons and nerves, and we're going to talk about the muscles specifically, but there's a lot else going on there. So
good point.
There are 3 layers of muscles. There's an outer layer, a middle layer, and a deep layer. And they kind of sandwich each other. That's the outer layer over there on my handy pelvis. That's the deep layer in there. I don't know if you can see that. And sandwiched in between is a middle layer. And they have 5 jobs. So job number 1, most people think about, they control your pee and they control your bowel movement. So they keep you continent. Job number 2 is they have a sexual function. So if these muscles are working effectively, you have healthy sexual function. If they're too weak, you're going to have a lack of sensation. If they're too tight, the muscles, then you start to have pain. Okay. The muscles have a supportive role. So my my handy pelvis comes with some organs. So I'm going to show you those guys. So these 3 layers of muscles actually hold up your organs inside of your pelvis. And those are your bladder. So your bladder sits right on top of your urethra. Okay. You have 3 holes at the bottom of your pelvis: your urethra, vagina, and anus if you're a female, and urethra and anus if you're a male. And I'm going to show you a female pelvis, but that guy there is your bladder. You see that? All right. Your uterus sits on top of your vagina, and your rectum sits on top of your anus. My putting together skills is not super awesome, but these muscles actually hold up all of these organs. And if they're not doing their jobs, then each one of these organs can start to sit a little bit lower than they should. So we often talk about prolapse, and prolapse is when these muscles are not performing the core function well, and then your urethra, your bladder, your uterus, your anus, they start to sort of sag a little bit lower than they should. These muscles help to pump blood back to your heart. And last but not least, this is my favorite job, and I think it's your favorite job also, the pelvic floor. It's part of our inner stability system. So I think the term core has been, let's call it, butchered in the fitness industry. But these muscles work together with your breathing diaphragm, your inner abdominal muscles, and your inner back muscles. And they create almost like a canister of stability for your spine. Your diaphragm is a muscle that moves up and down with each breath. Okay, I'm going to show you my little dance. So when you take a breath in, it actually descends down and allows your chest to expand and your lungs to take in more air. As you exhale, it springs back up. So every time you take a breath in, your diaphragm pushes down and essentially pushes into all of the organs that sit above these muscles and all these pelvic organs, and it pushes them downwards. And your pelvic floor muscles actually respond by descending as well. And so you have an inhale, exhale motion. And every time your pelvic floor springs back up, it engages your inner abs and your inner back muscles. And those are called your core 4 muscles. They're your inner stability muscles. They help to stabilize your spine, and they also help they're your internal pressure system.
No, that's a great
long-winded answer. Yeah.
No, but it's true, and that's how we educate clients, right? We explain these muscles because, I mean, a lot of us and a lot of women, just Google, Dr. Google, right? And to find out what our pelvic floor is. And really all that's out there is do Kegels. And there's no real explanation what your Kegel muscles are or how the core works. So just for anyone out there watching, when you read about Kegel muscles, Kegels tend to be referred to as just isolated pelvic floor contractions or activation. So we'll be talking a bit more about that with a couple other questions. But exactly what Hannah said. Exactly. That's what, and really, if you talk to a pelvic health physio, that's more the direction that a lot of physios talk about it, is an actual system. So I'm similar with Hannah. I talk to my clients about the deep canister and those deep 4 muscles working as a unit versus isolating just the pelvic floor.
Talking about that, Anita. Sorry. A lot of people take that information. When I talk about your core and your inner core, they actually take that to mean that your abdominal muscles are bad. They're not bad. They're just not there to stabilize in the way that we're told in fitness classes, like engage your core, engage your core.
Yeah, that we need those deep muscles to really understand how to work. And then, especially with pregnancy and then retraining them after birth, get that deep canister to help support you. And then building on all the other muscles, because really everything should work together. But sometimes those deep muscles kind of don't work as well after birth or during pregnancy. Things change a bit. And then
what happens to them? They're like pushed, let's call them stretched, push out of place. They're, a lot happens to them during pregnancy. And so be almost reminded what their jobs are.
Totally. Yeah. No, that's a good way to put it. Yeah.
Can I ask you a question?
Sure.
Okay. So we had another question. And I actually love this question because people ask a lot about their posture, thinking that they have to do shoulders back and So everybody walks into my office and like the second I say the word posture, they're like, okay, and they like organize themselves. But we got asked the question: does posture affect how your core works? And we now understand what core means. So I love this question.
Yeah. So building on what Hannah had just talked about, so our posture can really affect how our core works. And ideally, we want to get to the point where we don't have to think about our posture, that we can engage our core in every different posture throughout the day. And sometimes when we're first retraining that core, whether you have pelvic floor core issues or you're trying to prevent them, we start with certain types of postures and then build on that. So the initial posture I encourage clients to try and often helps their symptoms is thinking of a couple different things. So Hannah talked about our diaphragm and then our pelvic floor. So your pelvic floor at the bottom and your diaphragm, which lives underneath your ribs. And so if you think of those two muscles, so your pelvic floor and your diaphragm working together, and a great way to think of it, if you think how a piston works. And Julie Weaves, who is a physio in the States, she talks about it as a piston. And I find that image works really well for clients to understand. So that idea that as you breathe in, your diaphragm lowers and your pelvic floor lowers. As you breathe out, your diaphragm lifts and your pelvic floor lifts. So we want that kind of movement. And oftentimes when we first see clients, it's the opposite. They're doing a breathe in and breathe out. So this is happening versus this. So to get that piston movement going, what you can already start doing, and if you're watching this, try this at home. You can try it right now. So whether you're sitting or standing, you want to stack your rib cage over top of your pelvis. So if you're standing, you may find that your bum is tucked under a bit, or you're slouched. So your hips are actually in front of your rib cage. So even if you think of bringing your hips back a little bit so that your hips are right under your rib cage, then try a deep breath in and out. So a deep breath in through your nose and breathe out through your mouth, and just notice where your air goes. So does your air mostly go into your ribs? So another idea, think of your ribs like an umbrella or like an accordion. Does the breath go into your ribs and then breathe out and they just soften back in? If that happens, it likely means your diaphragm and pelvic floor are nice and stacked, and that's great. And that can really help your pelvic floor. If you take that breath in and out and you find the breath goes mostly into your chest or mostly into your abdomen, it could mean that your diaphragm and pelvic floor aren't quite stacked. And so just changing, move your hips back a little bit or shift your ribs a little bit forward and check in a mirror to the side to get to that point that you take a deep breath in and out and it's mostly in your ribs. So I have a lot of clients try that out, especially new moms. If you're baby wearing and you're not quite sure where you're standing, I have them just randomly take a deep breath in and out and just notice where your air goes. And if it's not going mostly into your ribs, adjust your posture and then keep going with what you're doing. So that works really well in standing. So the ribs over pelvis idea. And what we also talk about is neutral spine. So for those who have heard of that but not quite sure what it is, it's that natural curve in your low back this way versus a lot of times we tuck our bum under and the curve is this way.
Use that curvature altogether.
Yes.
Flat.
Yeah, it often happens like during pregnancy, right? Because our belly grows, our chest grows, everything grows in the front. And so our bum kind of tucks under to try to help. So if you think of sticking your tail back is another way to think of it for that posture, and then try your breath.
Yeah.
In sitting, what you want to do is the sit bones that Hannah talked about. So these sit bones right here. And so
you feel those sit bones regardless. A lot of my ladies are like, no, there's not enough. I can't feel those.
No, yeah,
but
definitely.
Feel those regardless. All right.
Yes. Yeah, definitely. You can, in terms of you just feel when you're sitting, put your hand under either bum cheek, and you're trying to find these kind of bony parts on either side, and you want to sit on them. And if you're sitting on them, what will happen is you're again in that neutral spine without even trying. And usually we find ourselves opposite, right? Kind of that tucked under, and you're actually sitting on your tailbone, which can sometimes be contributing to tailbone pain that you're experiencing or other symptoms you're experiencing. So in sitting, the key tip is try to sit on your sit bones and To do that, it can actually be better to perch more on the edge of your chair. So whether you're at the office, you're at home, versus sitting right at the back. If you sit at the back, you may, even with an awesome back support, you may actually be slouching. I'm not sure if you find that, Hannah, with yourself, like when you actually do it, because I find I prefer to perch and I sit on my sit bones a lot better.
Yeah. Listen, I don't think that when we talk about posture, it's such a hard topic for me, because I don't really believe that you should spend your whole life in a single posture. Exactly. Our bodies are made to move. These are just tips for helping to find that optimal breath and finding ways to stop yourself. So once you're stopped, then you can, like you said, go on, wear your baby, but then take a moment, make sure that you're aligned properly.
Yeah, and I find, and Hannah, you can let everyone know if you find the same thing, is as a pelvic physio, and we'll talk a bit more about what an assessment actually is with a pelvic physio, but when we assess the pelvic floor internally, because that's where those muscles are, when women actually initially try to engage their pelvic floor or their whole core system, and they're flat backed or their tail is tucked under, their pelvic floor strength and contraction is a lot weaker than when I cue them to go more into that tail out position. So in line, you can almost think of a little grape under your low back or a little space. And I have them reactivate those muscles. They are always stronger in that neutral spine versus flat back or tucked under.
Encourages tightening of those muscles.
Exactly. So Hannah and I are both saying that it can be a great way if you're wanting to resolve pelvic floor issues or you're trying to prevent them, is starting with that posture and just being mindful of that posture. But the ultimate goal is eventually being able to activate your core in any different position. So we're not saying you have to live in neutral spine, but initially it may be helpful to be mindful throughout your day to find that posture.
Exactly.
Awesome.
I mean, we talked about this briefly as well, but, even using your breath to help determine that, already you're starting to engage because these four muscles work together. Your diaphragm is your breathing muscle, and you need to breathe to live. So inherently, that's going to sort of set the tone for the rest of the muscle, for these four muscles together. So if you already find that you're breathing properly, chances are you'll start to get that relationship between those two muscles going well. Yeah,
totally. And then, so that's actually really a good lead in. So our next question for Hannah is, what symptoms would tell me that my pelvic floor isn't working well?
So we had chatted briefly about the five jobs of the pelvic floor muscles, right? Number one was sexual. So if you're having pain with intercourse or any sexual activity, you have lack of sensation. If you're like, something, I used to feel something and I don't feel it anymore, that's a sign that maybe you would benefit from pelvic floor physio. If you're leaking at all, ever, under any circumstances, that's a sign that you need pelvic physio. Even if it's just when you have a full bladder and you cough or sneeze and you leak a little bit of urine, that's a sign you need pelvic physio. If you're leaking feces, you benefit from pelvic physio. Likewise, if you're constipated, you would additionally benefit from pelvic physio. We think about constipation a lot in terms of our food intake and our water intake. And, I see lots of clients who are doing amazingly with their diet, and their muscles are too tight, so the stool can't actually exit their bodies. They're doing everything to bring it to that point, but if your muscles are clenching around your bum, that stool can't get out properly. If you have things like hemorrhoids, if you feel either at the entrance of your vagina or the entrance of your bum that there's something there that wasn't there before, that the organs are hanging lower, if you feel heaviness, if you have back pain that just isn't going away no matter what you do, if you have hip pain, pelvic girdle pain, people are like, whoa, what's that? Well, a lot of women during pregnancy feel they get the front, their pubic symphysis, the point where the bones come together here, starts to feel like it's coming apart. And our pelvis is a super stable joint, and it's super stable bones. And they don't just come apart, but very often during pregnancy or postpartum, it feels like that. And that is certainly something that a pelvic physio can address as well. We see lots of clients coming through our doors for rectus diastasis, for abdominal separation. So after pregnancy, some women are left with like this mummy tummy. Some try to do a sit up and they see this like big deep gulf between their two sides of their abs. Some all of a sudden see their abs poking up like a teepee. That's all signs that your abdominal system isn't working the way it should. We definitely see that as well. You can definitely jump in here if you haven't.
Yeah, no, because I'd say also feeling like you have to go pee all the time. So if you feel like you have to pee more than every couple of hours,
or actually going to pee, not just even like you know that urgency, or actually peeing all the time.
Yeah, both. Or feeling like you have to rush to the washroom. That can be another sign that the pelvic floor maybe isn't doing as well as it could. And sometimes this comes on during pregnancy, but I find actually a lot of women who talk about it during pregnancy and perhaps it increases, they say, you know what? No, actually, I've had this happen actually before I was pregnant, and now it's just worse. And so it's more noticeable.
I should mention also that, I mean, as physios, we're about optimizing health, not just fixing problems. And so one of our favorite things to do is actually, and I know it's one of your favorite things too, is actually to women prior to pregnancy, to prepare them for labor, and to optimize their labor and delivery, and optimize their health prenatally and postpartum. And so, more and more we're seeing, I'm having clients coming in because their mothers or sisters or friends are now saying to them, if you've had a baby, you need to go be assessed. And some of them, they come in and we're like, you're doing great, keep on, see you later. And some of them, we have a couple things to work on, and then they go. But we have a lot of, I really do believe that any woman who's had a baby should be assessed by a pelvic physio. I'm not super objective when I say that, but there are certain, you don't always know if there are issues with your pelvic floor. And we do know, between 10 and 20 years for you to actually see symptoms. And we know that the best medicine is proactive, right? Like, is preventative. So one of the best things you can do for yourself is find out what's going on and make educated decisions.
Yeah, no, definitely. And I just thought of another common issue that we see is tailbone pain. Because most women have no idea that the tailbone is related to the pelvic floor, but how Hannah mentioned, how your tailbone right there, you can see your pelvic floor attaches in.
All the muscles attached to it.
Yeah, so definitely that can actually be related to your pelvic floor and not even know it. But yeah, let's, in terms of anyone who's joining us, please say hi, let us know where you're from, and let us know any questions you have that we haven't already chatted about. And so Hannah, a really good next question is, do Kegels really work?
So, I mean, we've talked about this already a little bit, but what I would like to talk about specifically is the fact that Kegels aren't always the answer. So when we're talking about, when people think about Kegels, they think about just squeezing and contracting and holding in their pee. I think that number one, we've done a really good job of socializing our women and our girls to suck in their tummies and hold in their pee all day long. We're actually really good at holding our muscles in, realizing that this is a system. There's no muscle in your body that should ever really be held all the time. Like, that's not how muscles work. Muscles need to be able to contract, and then they should relax. And the pelvic floor muscles specifically work together with these three other muscles. They work together with that, with your diaphragm, your pelvic floor. When you can't just Kegel, because then what you're doing is you're actually not using this stability system. So you lose that supportive function of these four muscles together when you're just Kegeling. Number one. Number two is a lot of women. Thanks, Shane.
Hi, Shayna. Thanks. We're glad you're joining us.
A lot of women are actually holding their muscles all the time. So Kegeling, if you're talking about a muscle that's clenched all the time, Kegeling would just clench that muscle a little bit more. Hi, Trish. And so if you're using your muscles all the time, then and you're squishing them all the time and you're never relaxing them, getting somebody who's having pain or leaking urine because they're clenching the muscles all the time is actually going to make that worse. So we need to be using those muscles together, and whether the diaphragm is moving through helping to relax the pelvic floor, or by aligning, you're actually just allowing those muscles to work together. It's really about getting this system working and not just about muscles in isolation.
And I think I often talk to clients about, any other movement we do during the day. So even if you, to pick up your baby, or, you're picking up a bag of groceries, anything you do throughout the day, nothing we do isolates one muscle. So it doesn't make a lot of sense. For some women, isolating the pelvic floor does work and has worked. That's been a common practice for years. But for some women, it's not enough, because it's just during the day, that's not really how our body works. So a lot of times that resonates with a lot of women, and maybe if you're watching, it resonates with you, that we just don't isolate other muscles. So a Kegel is really an isolated pelvic floor contraction. And so oftentimes we don't necessarily teach you how to activate your pelvic floor that way. That being said, thinking back to that piston breath we talked about at the start, where you're inhale and exhale, it can feel a little bit like kind of, rubbing your tummy, patting your head, that it's a lot to think about. So it is something that can take practice. And a lot of women find, they come and see me and they're like, oh yeah, I've done Kegels. I do them at stoplights. And then when we actually do, the full core breath, that piston breath, a lot of them are like, oh, I can't do this at stoplights. It takes way too much focus.
Yes, you have to stay, you have to focus. Yeah. And they're very cognitive at first, right? They're in their heads a lot, but it does become natural. It definitely does. And I always say it's like the equivalent of, if you need your whole hand to do something, it's the equivalent of exercising one finger as opposed to all five fingers together.
Yeah.
One without all the others.
Totally. So why don't we, in terms of, let's teach in terms of how to actually engage that deep canister. And this is so if you're at a point that you're ready to strengthen, and we'll talk a little bit more about the other side in terms of tension in your pelvic floor and what to do about that. But we'll show you in terms of how to actually engage. Exactly. They don't work in isolation. Trish is commenting here. She's a public health physio in Barrie, who's amazing. We've all worked together. Yeah.
If you live in Barrie, go to Trish.
So let's do in terms of, let's say if you're watching and you're sitting. So that idea we talked about initially. So sitting on those sit bones. So sitting on these bones here.
I'm going to move back and doing it with you.
Yeah. So in terms of you're sitting on those bones, so you have that nice neutral spine. And just take a breath in through your nose and breathe out through your mouth like you're blowing through a straw. And do what Hannah's doing as well. So kind of the hands on your rib cage, that nice inhale, think of an umbrella opening. Yeah, nice inhale, umbrella, accordion opening, and exhale through the mouth. So if you're not getting the air quite into your rib cage, that's totally okay. This often takes our clients time to figure it out. But we're going to move on to see about adding or other core muscles in. So the rib breath gets our diaphragm, so the top part of our inner canister. To get the pelvic floor involved, what I want you to picture either blueberries, or you can picture a bean or a marble, something small at the vaginal opening and at the rectal opening, so the front and back. So you're gonna, as you breathe in, your diaphragm lowers, your pelvic floor will lower. As you breathe out, I want you to picture picking up both of the marbles or blueberries, whatever you're picturing. You're gonna grab them, so a bit of a squeeze, but then keep lifting. So as you breathe out, as you exhale, grab, and then you're going to lift inside of you. That's what you're picturing. And then as you
resonate better with, holding here, stopping gas. Everybody is different. And so they're, what's going to work best for them will be different. But the general idea is always to do some form of closure. And then we want to have that additional lifting of those muscles as well. It's not good enough to just stop yourself from peeing. Or, just Kegel. We actually have to have that closure around a blueberry or a bean or whatever, and have that lift up as well.
Yeah. So let's just try 2 all together. So if you do a nice inhale into your ribs, nice inhale through your nose. And then as you breathe out through your mouth like you're blowing through a straw, you're going to think of picking up both of those blueberries, beans, marbles as you exhale. And then inhale, you're going to picture putting them both back down onto your chair. And then again, as you breathe out, you're going to grab both of them and exhale to lift them. Perfect. And then inhale to place them back down.
And I think what's really important is you're also doing it slowly.
Yes.
When clients try to do it really quickly, you don't have enough time to get that a proper release or that proper crunch and lift. If you're just going, now exhale. It needs to be a longer breath.
Yeah. And as a reminder as well, this is where we start. So this is kind of that base, that foundational breath. This is not what we're doing week after week and having clients. This is all you need to do, right? As soon as clients are able to get this and we're able to see how their strength is, then we're going right to whatever your goals are. So if your goal is to be able to squat and not leak, if your goal is to run after your kids and not leak, then we're going to be progressing to things like using this breath with squats, using this breath with lunges, with single leg work, varying the speed, all of that, and different postures. So just to know that this is the foundation. This is not the end. This is where everyone starts, and then you build on that.
And so, often they're doing lying on their backs. And I'm like, if only we spent our whole day lying on our backs doing a cold breath, that would be nice. But that's not really life.
No. And that's often not where symptoms are. That a lot of women, there are some women who do have leaking when you're sleeping or when you're lying down. But oftentimes it's standing or sitting, those types of movements, and then moving with that as well, is where symptoms or pelvic pain, anything you're experiencing happens. So that's the type of breath. So you can try that at home. Try it in sitting, try it in standing, try it in lying, and then add other movements as well to challenge that a little bit more. So that would be more the strength component, and how Hannah talked about, we're doing that lift, but also remember to release down. If all you think about is lift, 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 you may create tension in your pelvic floor over time, and we don't want that either. So you want to think of your pelvic floor like a trampoline. We want strength, but we also want flexibility. So you want to be able to activate and release equally very well with that.
I say, if I was carrying 15 pounds in my arms and someone said to me, can you carry 15 pounds more? I would be unable to carry that 15 pounds. In the same way that if I'm only used to carrying 2 pounds, someone asked me to carry 15 pounds, I can't, if I'm too weak, it's not going to work. But the same way, if my muscles are so engaged all the time, they're already carrying all that stuff, they're also not going to work. So you need to have a fine balance between flexibility and strength.
Totally. And actually, that's a really good way to go into our next question. But it's good because we need to talk about all the different aspects of the pelvic floor. And this next one is something a lot of women don't know about. A lot of times what's out there is just do Kegels and just strengthen, because if you have pelvic floor issues, you must, be everything loose and everything weak. But so the next question is, if I'm leaking, my pelvic floor must be loose and weak, right? And so the answer to that is, Hannah?
So we sort of shadowed this. I'm like trying to follow here. I knew it was very organized. But the answer is no, like we just finished saying, there are many ways for muscles to not function. And we think about our shoulder, we understand that sometimes we overwork our muscles and sometimes they're too weak. But once we get past the fact that we're talking about our pelvic floor and that we're talking about our nether regions, these are muscles like any other. So in the same way that you can have symptoms when these muscles are too weak and not, similar to what we just said, if your body needs to carry 25 pounds around and your muscles are only strong enough to carry 15, those muscles are not going to do their job. But in the same way, if you're walking around and you've just been told to Kegel your whole life and you're Kegeling, and you're held up all day, every day you're clenching your muscles, those muscles are not available to function. They're equally That is not English. They cannot work in the same way that if they were too weak to actually activate, they can't work. And you know, that middle layer of muscles, there's those two layers, and there's a layer sandwiched in between them. And that middle layer is where we have these circular muscles called sphincters. And the sphincter muscles are sit around your urethra and around your anus. So their job is to hold in pee and to allow you to pee when you want to, and hold in feces and allow you to move your bowels when you want to. And if those muscles are too weak, so they can't stop the urine from coming out, that'll cause leaking. And that's where our brain goes all the time when we think about women who leak. We just think, oh, they're too weak, we have to strengthen, we got to Kegel. But you know, and we were chatting about this before we went live, but the majority of the women that I see in my practice have been Kegeling all their lives. They're awesome at clenching and holding and never letting go. But those muscles are so overworked that they can't actually do their job. They're too tired. I give the example very often about if you fall down and you hurt your back goes into spasm. You would put heat on your back, you would do some stretches, maybe go for a massage. When we see women postpartum, nobody knows what these muscles are doing. So nobody can pay attention and say, oh, I think maybe my muscles are hurting, or I think maybe my muscles are weak or too tight. We don't actually know what's going on until you do a pelvic assessment. So the information, knowing that somebody is leaking is not enough information for us to know why they're leaking. And that's why we do an internal assessment.
Yeah. And I think it's a good point in terms of, so the idea that just because we're leaking or any other pelvic floor issue, or even if you're not having pelvic floor symptoms, so whether leaking, pain, pressure, the idea is that sometimes those muscles can be tense. So just like any other muscle in our body, if you've gone for a massage or you've had someone massage your muscles and you feel tenderness, that can actually happen in our pelvic floor. So just like any other set of muscles, those muscles can actually be tense.
Right.
And so that idea that if they are tense, we actually want to work on releasing them. Because if you think of a bicep curl, if you're tense, so if you think you're kind of partially curled and you try to do Kegels, that's all you get. So you're still going to leak, and you may have pain because things are so taut and tense that we actually want to release those muscles. Yeah, exactly. So
with a movement.
Yeah. So tension also is a sign of weak muscles. So you can have loose pelvic floor muscles and they're weak, they're not strong, but also you can have tension in those muscles, which doesn't allow them to be strong either. So in that case, we actually want to release that tension. And so we're going to teach you a breath and a visualization that can actually help release tension in these muscles. And this is a breath that both Chana and I also teach our clients. Who are pregnant, because often, and I don't know about you, Chana, but a lot of the first time moms I see going into their, first birth often have tension in their pelvic floor. So this is a breath I use with them to release tension. It also helps with internal pelvic pain. So if you have pain with intercourse, inserting a tampon, pelvic exams, and for some women who leak, it's actually tension in these muscles causing the leaking. And we'll talk a bit more about that.
Yeah. Gets rid of it, and people are shocked by it when that stop leaking because they're just breathing, right?
Yeah, the breath, and I find the visualization that they work together. So you would still think of that same idea we talked about, sitting on your sit bones, so sitting on these guys here.
So then you have the edge of your chair, basically.
Yeah, just perching on the edge. Or if you have a yoga block at home or a nursing pillow, even sitting cross-legged on something to lift you up can actually help you.
Not with your legs crossed over each other like that.
Yeah, in terms of it can help create an openness in the pelvic floor. So the idea for this breath is you want to still do that inhale into your rib cage, that nice big inhale. And remember, as you breathe in, your diaphragm lowers and your pelvic floor lengthens. And then as you exhale, your diaphragm lifts, your pelvic floor lifts. But this breath is going to be a little bit different. So as you breathe in, I want you to actually picture a flower blooming, nice and open, nice and wide. And you're actually going to think of it blooming out of your vaginal opening. So you actually want to think of a flower blooming nice and open. And adding this onto your inhale can work really, really well to relax your pelvic floor.
And
then as you
have people add it to their exhale as well.
Yeah, well, that's where it's going. Exactly. So
similar.
as you breathe out, you want to actually picture keeping that flower open. So let's try this together. So if you're at home, try this wherever you are, whether you're sitting or you're lying down or you're standing. You're going to inhale, your rib cage opens. Think of your flower blooming nice and open. And then as you exhale, picture keeping that flower open. And try a couple there. So nice inhale. And then breathing out in terms of the flower staying open. So that's the flower bloom breath, or how it works really well to release pelvic floor tension. So as pelvic physios, when we're internal, checking how those muscles are working, when I have women do that breath, it works for the majority of women. It's really rare that it actually doesn't work. And basically what we're feeling is
exhale.
Pardon?
I think the key is also the exhale, like you said.
Because keeping that open.
If you're not giving them the opportunity to spring back up, they're like, okay, I'll lengthen for you, and then I'll hi, Alexandra. Then that really helps to keep those muscles lengthened and resolve a lot of those pain issues.
Exactly. So that is used for a lot of women. So it may be hard to know if your pelvic floor is, if you need to do your flower bloom breath, or if you're ready to go into the core breath or piston breath. But sometimes symptoms can even let us know. So if you're experiencing internal pain, and it may be from various reasons. So if you've given birth before and you've had tearing during birth, sometimes there can be tension around your scar. That can be contributing to that pain. So oftentimes flower bloom breath will work really well. Or women that we see after a cesarean birth, that even though it doesn't seem like the pelvic floor would necessarily be affected, but it can.
Once you understand the core four.
Yes. And you can tell in terms of, because the cesarean scar tends to be around here, and you can see your pelvic floor actually attaches up near that area. So if you think of with that scar, the layers down where there's tension, your pelvic floor can actually get tense afterwards, even though you actually didn't birth vaginally. So oftentimes I'll be working with women for that breath, or if you're preparing for birth, even if you don't have a tense or pain, internal pain, it's an amazing breath to use during labor and during birth. And we'll talk a bit more about that after, what we'll be talking about in 2 weeks. But I'd really encourage you to use that breath to prepare. So lots of different reasons to use that breath.
So you've been talking a lot about assessing your ladies internally, and this is one of the biggest questions we get asked. What actually happens during a pelvic assessment?
Yeah. So initially, so when you see pelvic health physio, initially, if you've seen any other physio, the first part is very similar. So we take a really detailed history. We talk about past injuries. We talk about general health conditions, any treatment you're currently going through for these concerns or other concerns. If you've given birth and you're open to sharing about your birth experience, we do talk about that, because that'll give us insight into how your core and pelvic floor is. And if you're pregnant and CNS, we'll talk about what your birth preferences are. So this will also give us guidance in terms of what to recommend. So that's the initial history part. And then we look at posture. So we look at posture, standing, lying down, various positions. And as well, we talk about your goals right from the start. So why are you in for pelvic physio? What do you want to get out of this? Because that's really going to drive what we recommend. And so looking in different positions. So let's say your goal is you want to not leak when you squat to pick up your baby. Well, we're going to take a look at your posture in squatting and in different positions that relate to that. So really we can give you tips on what you can change or tweak a little bit to help with what you're experiencing. We also look at diastasis. So how Hannah mentioned before, that abdominal separation. So your left and right abs, there's tissue along the center that tends to stretch with pregnancy, which is normal. We do need to stretch to allow the baby to grow. And afterwards,
normal.
Yes. And the 8 weeks after birth, we get some spontaneous healing around that area. But often women need some guidance after that. But as well, during pregnancy, we can help guide you how to support your core and support those changes that are happening with pregnancy. Because kind of one of the latest studies show that within the third trimester that 100% of women will have a diastasis, so that separation. And another one says 66%. So majority of women will have it.
Yeah.
But that being said, it doesn't necessarily cause issues for all women. So everyone is very much individual, and that's how we look at things. For the internal part, and actually before we do the internal, we also look at your muscles and your joints externally, especially the ones that connect into the pelvis, to see is there tension there we want to address, or any movement concerns or issues that you feel like we want to address as well, and symmetry or balance within the pelvis. Internally, how it works is we actually show you, so a lot of pelvic physios will have a pelvic model, and I find this is really helpful. So we explain the pelvic floor muscles and the core four muscles like we did initially. And then for the internal part, so this is how we would explain it, and this is what actually happens. So initially we start on the outside, and we're actually observing the outside. So if you've had tearing in the past, with previous births or anything around the outside, any concerns, we observe those first and see redness, swelling, anything like that. And then we're pressing just along the pubic bone and down either sides and along, and you let us know if there's any tenderness. We also test sensation, so different spots in the inner thighs and just around the opening, and you let us know if it feels the same left and right. And we do actually do a small reflex by the rectal opening just to check the reflex that is down in the perineum area.
That's for some in other areas as well, the legs.
Yes, exactly. Yeah, so just like you may have your doctor do reflex on your knee, this is the reflex to let us know how the muscles down here are working. Then we'll have you do a pelvic floor, a tightening, whatever you think that is, a cough, and a bowel movement strain downwards. So we see naturally on the outside what your pelvic floor does on its own. Internally, so we tend to go vaginally first, but depending on what your concerns are and depending on what we find internally, that we can also go rectally to assess your pelvic floor, especially when we were talking about tailbone issues. To get to your tailbone, the best is actually going rectally. So we go over that with you, but initially we tend to go vaginally. And so on the inside, we're basically pressing along the different muscles on either side. And we're talking you through as we go, and you're just letting us know, is there tension in those areas, or tenderness, which could be a sign of tension. And then we'll have you the same pelvic floor tightening, a cough, and a bear down, so we know how those muscles are actually working. And so that really gives us insight where we want treatment to go or what to guide you with. And we start into the breath at that point. If we need to release, we start that flower bloom breath we were talking about, or we may start into the strengthening, kind of picking up that blueberry or that bean. So that's the internal part. Yeah. And then from there, so afterwards, in terms of we regroup and we kind of go over with you what we found in terms of kind of all the pieces of the puzzle to address your concerns and goals. And then we put together treatment or a guide on what we would recommend to help resolve or prevent your concerns. So that's kind of what we do in an assessment. So it's pretty detailed, and it's different than if you saw your doctor or your midwife for an internal. Often they'll do a PAP and that's for a different reason, whereas they may not necessarily look at your muscles. Some do, which is fantastic, and it already gives you insight. But sometimes they aren't looking necessarily at your muscles, and that's where a public health physio comes in to be helpful.
Right. Mm-hmm. Different roles.
Mm-hmm.
Yeah, it's and I think that it is very, although there's a general guideline for how we go about the assessment, it really does depend on a and it really does depend on what their goals are.
Mm-hmm. Exactly. Yeah. For everyone, it's different, and then as well too, if you're coming in during pregnancy, we also talk about preparing for birth as well within the assessment itself. So for anyone who's joining us, let us know, say hi, let us know any questions that you have, and we'll be sure to answer them live here, or we'll be sure to answer them afterwards in the replay. Amazing. So let's check in terms of our next question.
So you're talking about assessments.
Yes.
And the internal assessment. And we had chatted about this actually earlier, but we were talking about women who come in with pain. And their concern is that every time they've had an internal assessment, they've had pain before. So they walk into your room and they're like, well, I'm here because I have pain with tampon use, pain with vaginal intercourse, and pain every time my doctor assesses me, but I don't want you to assess me. So what do we do? And I think that our biggest job as physios is to help people with their pain. So I say a lot, we're not going to, somebody's in pain, we're not going to be like, well, suck it up, lady, and let's get in there. Pelvic physio is not a no pain, no gain situation. It's certainly a very delicate relationship that we are building with our clients. And there's so many things that attach to the pelvis. All of your, we talked about how your abdominal muscles attach, your glute muscles back here attached to your pelvis and your pelvic floor, your inner thigh muscles, your hip adductors, your hip abductors, your hip flexors, all these muscles that, there's a whole slew of stuff that attaches to the pelvis. And a lot of times somebody walks in tons of pain, there's a lot we can do before even chatting about doing an internal assessment to help relieve the pain. And I think that that's like a big deep breath for people who are worried to come in to see us because they're worried that we're going to get in there with our elbows, but that's not how it goes. It's our job for them to walk out feeling better, not to having feel worse.
Yeah, exactly. So if you're sitting and you're watching us and you're like, oh, I've got pain, exactly what Hannah was mentioning, and so I'm nervous to go see a pelvic physio, just to know that we don't actually have to go internal to assess your pelvic fully. Oftentimes, if you're letting us know all these different pain symptoms, what we actually do is there can be a lot of muscles on the outside to already start addressing. So we can work in terms of on those and give you different postures. So there's actually a lot of yoga postures, so restorative and yin postures, if you're familiar with yoga.
And like breathing.
Yeah, exactly. That flower bloom breath, already getting you started on that. And then as well, there's a big part of the pain component in relation to our nervous system. So that idea, if you've heard of the fight or flight response, and that's the part of our nervous system that kind of causes everything to tense and to tighten. And you might, in terms of feel basically a general tension. And then there's the other side of our nervous system, kind of the rest and relaxation side. And we want to try to bring that up, which can actually help decrease the other side, which can help decrease your pain. So we'll often talk about different ways just to help bring down any stress in terms of your day-to-day life, or ways to bring in some mindfulness, meditation, or just strategies in general. And deep breathing is one of them, just to help bring down that tension and be mindful. So different strategies throughout your day. I have some clients even who will make sure they'll put together a music playlist that they listen to on their way to work that can actually help decrease that stress going into perhaps a stressful environment. So things like that you'll talk about with your physio, because that can greatly affect the pain you're experiencing too. So just so you're aware, if you're nervous to see a pelvic physio because you're experiencing pain, know that they don't actually have to do an internal assessment until you feel ready for that. And don't even think that it has to happen. There's lots of different ways externally to address that.
And what I would add is that, I think that the majority of our clients are nervous when they walk into our doors. So it's something that we certainly are aware of and are sensitive to. And, like we talked about, we're trying to optimize people's health here. And, we talk about diet and exercise and, sleep, proper sleep patterns, but a huge element to optimizing health is evoking relaxation response every single day. And often it's a piece that's missing in our very busy clients' lives that really helps with the pain they're experiencing.
And I wanted to make sure that we got a question in as well. And thank you everyone for sending in these questions. These have been amazing. Awesome. And a lot of women had really similar questions. And one that was someone asked specifically, and it was different, is from Lindsay. And she asked, if you suspect someone has a tight pelvic floor, would you recommend they stop Kegels until they can be seen by a pelvic until you know more? And if someone is finding it more painful when they do Kegels, and in her experience in her tailbone, is that a sign to stop? So I think that's a really great and a specific question, and bringing in the tailbone. So if you're feeling pain when you're doing that initial kind of core breath or piston breath, kind of that strengthening, it can be a sign that perhaps hold off on that, do that flower bloom breath, that relaxation we talked about, and do that for a bit, and then maybe try the strengthening again and to see if that's gone away. If this is all before you can see a pelvic health physio, or you may not be able to see one. There may not be one near you, or you may not be able to see one for other reasons. So it's a really great question, Lindsay. And so I'm sure Hannah's similar in her recommendation that to take a break from doing kind of the Kegel or the kind of the strengthening component, focus on some release work, do your flower bloom breath, and then bring it back and see if that's actually takes to it.
And I talk a lot about I talk a lot about coordinating the muscles as well. Like we assume that once we release, we can just start strengthening, but that's not necessarily the case, because if muscles are very used to being tight all the time, if you spend lots and lots of time doing your flower bloom and releasing them and lengthening them so that they can fully, they're at their full resting length, you can't just start tension them again. So what I often recommend is to create a ratio that still stays on the side of lengthening while you're starting to introduce that core breath stage.
Yeah.
So almost like, one breath that involves that lifting of the pelvic floor, and then follow that by 2 or 3 breaths where you just have the flower blooming.
Exactly.
Start to play with the ratios and make sure that pain is not coming back. And then you can start to drop the breaths in between with the flower blooming until you can get to that inhale and drop, and exhale and engage the pelvic floor.
Yeah, exactly. Yeah. And I'll do very similar, and kind of that idea that once we lengthen, exactly, if you jump to just strengthening, sometimes the tension comes back. So I'll even have women do kind of similar to what Hannah mentioned, or start with a few flower blooms, do a set of 10 or so of your core breath or your piston breath, and then finish with some flower blooms as well. So if any tension was created, it'll release. So there's different ways you can play around with it. If you're seeing a pelvic health physio, they can definitely help you figure out what exactly you need. But if you're not able to see one, or before you see one, you can try out the different breaths we talked about today to see which one is the most beneficial. And I want to say hi to Lauren. She commented, this is amazing information. I think it needs to be discussed more to get this info out, because anything you Google, most information leads right to surgery before the only option to help. And that's exactly right, which is really unfortunate, because the actual evidence for a lot of things, so including for incontinence or for leaking, is to actually see a pelvic health physio first. It should be.
I think that there's like an 80% in the research. It's 80% success rate with pelvic physio. As opposed to going, doing something drastic, like start with something that is reasonable. It's exercise. We can all do it. And baby steps before you jump towards surgery. I know we're working on educating.
Yeah, no, definitely. So if you're watching this and you know that there's other women in your life, whether your mom, your aunt, your sisters, your cousins, your friends, who maybe have told you that, there is no other option other than surgery, or you just have to live with it, share this information, share this video with them so that they know that there is actually other options to help.
And I tell my ladies, I'm like, and gentlemen, we see some gentlemen too. Like, we create advocates. Once you have this information and you see how it changes your life, you got to share it. You got to share it with the other people.
Yeah. And one of our next questions, which we're going to be talking a lot more about this at our next Facebook Live that you should join, is can you see a pelvic floor physio when you're pregnant? And the answer is a definite yes. So with seeing a physio while you're pregnant, everything we talked about, so preventing or resolving the common pelvic floor and core issues we've talked about, but also preparing your body for birth and preparing your pelvic floor for birth. So a lot of women come in and see us that they're concerned, either they've given birth and they've torn and they want to avoid that again, or they're first time moms and they hear all this from their friends, I don't want to tear, the pain scares me, I'm really actually fearful of giving birth. And that's something a pelvic physio can also work with you through and prepare you. So help guide you on exercise during pregnancy, prepare you for the actual birth and help you create a positive birth experience. And then also give you the education ahead of time on how to prepare efficiently after birth. Yeah. And so we're going to be diving more into this topic. So I really encourage you to join us. So in 2 weeks on June 5th, same time, same place, we're going to be talking about, can you really prepare for birth? So we'll be talking a lot more about it then. But for right now, just so you know, the answer is yes. And everything we've talked about does apply
your doctor has specifically stated, or your midwife has specifically stated otherwise.
Yeah. And even so for some women, depending what's happening, some women, if they're told by their doctor or midwife that you can't have intercourse or any sort of internal penetration or exam, anything like that, definitely still seeing a pelvic physio. There's a lot we can do externally to help you prepare for that birth.
Women sometimes feel disempowered by their first birth or by their experience with their healthcare practitioner, and so that's what we can provide. We empower. We provide empowerment through education and by teaching you how your body works.
Mm-hmm. Exactly. So a lot can be done, and both Chana and I have taken specific birth doula training for physiotherapists. So we add that to our assessment, to our treatment, and we absolutely love working with women during pregnancy. So you can always check with the physio near you as well to see if they do help you prepare for birth. And work together with your care provider and your birth team, which is always fun and always fantastic, and ends up being a well-rounded positive experience for clients as well.
We're always working with your birth plan, right? We never walk in with our own, agenda. So help you get the birth, achieve the birth that you were visualizing.
Yeah. And then in terms of Chana, so the question asked is, does my doctor or midwife check my pelvic floor at my 6-week postpartum follow-up? And if they give me the green light to go back to exercise, can I go back to all types of exercise, or what should I do? What shouldn't I do?
So I love this question because the answer is it depends. Although it doesn't really. The reality is at 6 weeks postpartum, it's a completely arbitrary number that we've come up with. And if you think about what your body has done in 9 months, it is a completely different body than you had prior to pregnancy. And then after delivery, it's a completely different body. And so even if when we talk about our core 4, we have to rehabilitate that whole relationship. But even if we set that aside for a moment, you're dealing with a body that's essentially deconditioned. And a body that still has hormones racing through it, a body that has been stretched and altered, and the position has been changed. Your center of balance has been altered. You almost have to relearn how to function within this body. So the answer is there is no exercise that's off the table in the long run, but you have to retrain your body how to safely perform that exercise.
Mm-hmm. Yeah, kind of those that deep canister. It goes right back to that very first question we talked about. So getting that deep canister just to, be strengthened and just supportive in terms of everything you need to do after birth as well. So whether you've had a vaginal birth or a cesarean birth, it's the same idea in terms of recovery, that you want those muscles to be retrained before jumping into things like jumping or running or high impact, high intensity activities. Taking the time to actually retrain that deep core can benefit you in the long run. So even if after birth and you don't have any of the things we're talking about, you don't have pelvic pain, no leaking.
For success, right?
Yeah, that you want to keep that up. You don't want to kind of take a step back later. Or if after birth you are experiencing any of those concerns or issues, it's important to retrain and resolve those issues and then build back to your goal. So any pelvic health physio you see, their goal should be your goal. So if you want to get back to weightlifting, running, CrossFit, anything in terms of yoga, Pilates, and it doesn't matter, even if you're someone who doesn't want to do those types of activities, just to be able to live your life without any of those symptoms and just live life to its fullest, feel strong in your body and feel confident in your body, that's what a pelvic physio should be helping you do. So in terms of with the question at that 6-week follow-up, it varies. I've had some women see me after birth, and at the 6-week follow-up, their midwife or doctor has checked those pelvic floor muscles, and they've actually said, you know what, these pelvic floor muscles are weak, or they've found a prolapse. So the bladder, uterus, or rectum has lowered into
pelvic physio.
Yeah, and they actually say go see a pelvic physio, and that's fantastic. And sometimes they don't. So sometimes after for an internal, it's only if you're due for a PAP exam that they'll do an internal. And at that,
nothing.
Yeah, they're not looking,
talking, and then they leave the appointment. They haven't had any assessment whatsoever.
Yeah, they're not necessarily looking at your pelvic floor muscles for that. So it can be a good idea to check how those muscles are working, seeing a pelvic floor physio afterwards. So kind of after that 6-week follow-up, or you can see them before and they'll check everything on the outside. So your diastasis, posture, how everything is balanced and working. And then if you can't see a pelvic health physio, even taking the steps that we talked about. So check in with your posture and your alignment, those positions, especially after baby has come out. Your body has gone through a change, right? So in terms of getting back on
diaphragms, like up in your neck during pregnancy, not literally, but it feels like it sometimes.
Yeah.
Your pelvic floor was carrying so much more weight. Your abdominals were stretched out. Like everybody's core 4 was affected by pregnancy and has to be rehabilitated. Doesn't necessarily mean a pelvic physio, but it does need to be addressed.
Yeah. So kind of the tips we talked about, I really encourage you to try those at home, whatever stage you're in, whether you've never been pregnant, never given birth, or you are pregnant or you have given birth, is try out the posture and alignment tips we talked about. Try the engagement, so that piston breath or core breath we talked about, and try the flower bloom breath. And then when you know kind of what works for you, then building that into your other activities and movements is really what's going to help restore your deep core to help you do those different movements without symptoms. And if you get a chance to see a pelvic health physio, internally checking those muscles really is a great way to let you know how they're working, and they can help guide you in terms of getting back to those activities that you love without dealing with any issues. Yeah.
And I mean, we know that from research that these 4 muscles are anticipatory muscles, right? They're muscles that actually should turn on before any movement. So part of that is to practice that core breath, practice that flower bloom, get that system going before you actually engage in your movement.
Yeah.
If somebody, if somebody is past that 6-week mark, is it ever, in your experience, is it ever too late to actually get seen?
No, so a lot of women ask that, and it's never really too early. So seeing kind of before you have symptoms, before you're ever pregnant, but it's also never too late. So oftentimes, I think, Hannah, it's similar in terms of we'll see women who are pregnant or soon postpartum, and they go, you know what, my mom has these issues. Can she see you, or is it kind of too late? She had kids 30, 40 years ago, and it's never too late. So we see women in all stages. So even during menopause, postmenopausal, it's actually never too late to get these muscles assessed and to change these symptoms and prevent them too.
Still change those symptoms as well.
So never too early, never too late for these muscles to work the best they can work. So just to keep that in mind. Awesome. So if anyone has any last questions, post them below. We'll make sure we answer them before we're off the live broadcast. And so we want to make sure you know, so Chana and I will be back. So every second Monday, we'll be back with a new topic. Yes. And so our next topic, so on June 5th, is going to be, can you really prepare for birth? So we're going to be talking about a lot of different aspects in regards to your pelvic floor, your core, but in general, holistically preparing for birth. And then as well with that, we'll also be talking about, you know, those first few weeks postpartum, how to help with an efficient recovery as well. So if you're an expecting mom, you know an expecting mom, you're a doula, you're a childbirth educator, you really can't miss this. So we're excited to see you back on June 5th. And as well, send us your questions. So
any questions? Your questions for this, this little shindig here.
Yes. Yeah. So thank you very much for sending them, and keep them coming because we'll be sure to answer them. And as well, if you're catching us on the replay and you didn't catch us live, make sure you leave your questions below, and Chana and I will make sure that we answer them for you. So Chana, where can people contact you in person, but then also how can they find you online?
So you can find me on Facebook at Vital Physiotherapy and Wellness, or on Instagram. I think we've been on for 2 weeks now, so I'm really proud of us. We're at Vital Physiotherapy and Wellness. You can find us, contact us through our website, www.vitalphysiotherapy.com. Or you can email me, chana@vitalphysiotherapy.com. And Anita, where can we contact you, my dear?
Yeah. So you can find me as well on Facebook or Instagram at Holistic Health Physio. You can find me on Twitter at holistic_physio. You can catch up with me on my website at holistichealthphysio.com, or you can contact me by email at anita@holistichealthphysio.com. And so if you haven't already, definitely find us on Facebook, like the page, so the Vital Physiotherapy and Wellness page, or the Holistic Health Physio page.
We're really trying to educate. We're trying to provide things on our pages that are going to help educate our anybody who follows us about pelvic physio. And I'm really happy that everybody tuned in tonight, but also an excuse to hang out with you, Anita.
Yeah, I know. Yeah, so definitely find us on Facebook. Like the pages so that you stay up to date. Pelvic health info, as Chana mentioned, as well as to be up to date on our next topics and when our Facebook Lives are. So every second Monday, same time, same place. And stay tuned. We're excited to see you on June 5th to talk about, can you really prepare for birth? So awesome to see you, Chana. Excited for our next one.
Have a good night, everybody.
Yeah, thanks for joining us, and we'll see you again soon.
Looking forward. Bye, Ed.